our vitamin D metabolism affects our immune system, how our B vitamins are metabolized affect our immune system, how we detoxify in our liver through our glutathione utilization affects our system, and then our antioxidant system. And everybody's heard of vitamin C. Vitamin C is an antioxidant.
Yes.
So these things are paramount to having a really strong functioning immune system.
Okay.
And when they're off,
guess what, guys?
We're not doctors.
No, we are not.
If you're going to be making any major medical decisions, please consult your doctor.
Yes, and that includes diets, exercise, medications, and surgery.
We love you guys.
And we want you to be in our OSLP family forever.
So be careful
and consult
your doctors.
Welcome back, OSLP family. Welcome back, OSLP family.
Welcome.
You are listening to our Sleep Life podcast. This is Kelly.
This is Mel.
I had to give her shit because last time I was like on it and she started laughing at me. So
it threw me off.
I don't know what the appropriate amount of time in between. So I gave it, a couple of points and then jumped in.
You. That was a good pause.
Thank you. I appreciate it. Still got you laughing.
Yep.
All right. Well, we want to encourage all of you to go over to our website, oursleeplifepodcast.com, and you want to sign up for our newsletters. That's going to be the first thing that pops up. And the reason why is because you get 2 newsletters a week from us. We always give you a little rundown of our newest episode. And then we do some like behind the scenes stuff with us, because we are traveling again.
Yeah, we're traveling again. We're going to go on tour this summer.
Yes.
So you guys need to watch those newsletters and sign up as soon as possible because they get to like the pre-sales. They get all the things.
Yes. But you know who gets it first?
I know.
Our patrons.
I love our patrons.
Our patrons get first crack at everything.
And discounts.
And
on everything.
Good discounts on everything.
Yes.
So you want to go up to the top right corner of our website, click the little button that says become a patron, and you want to choose the $7 higher. Now, if you choose that, you will automatically be entered into our Facebook group, which is called the Winner's Bench. And you get a hell of a lot of people in that group.
Oh yeah, we have almost 300 people.
Mm-hmm.
It literally ranges from like 24 to their 60s. We have men and women in there, pre-op, post-op. Like if you have a problem or you want to celebrate, that is the place to go.
Yes, correct.
100%.
Yes.
And we even do a Patreon meeting every single month. We have one tonight. And we always pick a topic and everybody comes in and just discusses what's going on in their lives. We celebrate wins. We support them when it might not be wins. And it's just a great place to be. So go do that. And then the last thing you need to do. It's free. We love the free stuff.
Yes.
Which is just go to YouTube. It's on your phone.
Preloaded.
Click that bell, hit the subscribe button, and then you do get a video of the episode every single Tuesday morning.
And then you would know that we have had a guest here the whole time.
Yes.
And he's been very patient with us as we roll through all of these things.
Yes.
So we want to welcome on Dr. Rob.
Yay.
well, thanks for having me.
Of course, we are excited to listen.
So, Dr. Rob, what is your specialty?
Yes.
So everyone can know.
So I've been in plastic surgery since 2004.
Okay.
And predominantly, I took care of cancer patients. So I took care of head and neck cancer patients, breast cancer patients, and patients with sarcomas, which are tumors of the skin, fat, muscle, bone, typically.
Okay.
And predominantly, I did microsurgery to care for them. So I would transport tissue from one area of the body to another and hook it up to a new blood supply using an operating room microscope. And because cancer, reconstruction, predominantly, you would say breast cancer is the most prevalent form that I would see I would do more of that than the other forms of reconstruction. And that led me to caring for patients who over time may develop implant related issues secondary to radiation therapy or problems with capsular contracture or pain or an infection or something that would lead them back to a tertiary referral center. I usually worked in big centers, and microsurgical technique would be used typically to care for those patients. I also developed techniques like many other surgeons do to help care for patients with implant related problems. So trying to improve the situation for them. And that kind of led me to taking care of patients with breast implant illness and doing explants.
Okay.
Wow, so much. What got you into that?
Yeah.
Like, how did that even happen?
So I had a patient relocate from Georgia to retire here in Austin, Texas, where I practice.
Okay.
And they didn't want their reconstruction anymore. They wanted to go flat. And I think there used to be, unfortunately, a fair amount of stigmatism about patients who didn't want reconstruction or who wanted an aesthetic flat closure, which was odd to me. I mean, basically, we would help do whatever the patient really, after being informed about the options, whatever they chose. I mean, we would help them, through that process. So I met with her, did her consultation, reviewed all of her studies and her labs and everything. And she only had really one dominant feature, which a lot of patients who go through cancer treatments have, which was fatigue.
Yeah.
And so, we made preparations for her to have her surgery and do her explant. And I did them a particular way because of my background in oncology. We'd always take everything out intact and send it off for culture and make sure there was no residual or recurrent disease, meaning no recurrence of cancer. And I did that for her. Her surgery went really well. And at a week, I saw her and went over a pathology, and there was, most importantly, no recurrent cancer.
Yay.
Nice.
But she had an infection.
Okay.
And that's really an unusual thing to find.
Mm.
And so I went back through all of my notes and exam and, all the studies we had obtained. And I couldn't figure out how I had missed an infection on somebody.
Yeah.
So traditionally, they'll give you a little report of what antibiotic therapy would help that patient. So we did that for her. And what do you know? All of her fatigue went away.
Wow. So the infection was causing all the fatigue.
Yeah, and it was an unusual thing, and I believe she put me on a list of surgeons on Facebook that she recommended or had experience with doing, explant surgery. And then where everything changed, I had people start calling our office in Austin requesting a consultation regarding an explant. And my office at the time was like, what are these people calling, wanting the surgery for? Because we did predominantly breast cancer reconstruction, but now these people were, interested in hearing more about explant surgery. And so that started to become a component of my practice along with my breast cancer reconstruction. And, fast forward now, I basically only perform explants, and I do holistic transformations with fat. So someone can have an augmentation with their own fat. But I have people, come from around the country and around the world to just have an explant done with a lift and or fat transfer at the same time.
So what is that exactly?
So if someone has a breast implant, and we'll say it's a cosmetic implant, we will do a procedure where we take all of the scar tissue and the implant material out together.
Okay.
Without some sort of reshaping or tightening procedure. And then we'll take fat from usually inner outer thighs, abdomen, flanks, love handles. And those will be basically our instrumentation processes it and contains it. And then we put it back under a specific amount of pressure through, not in the breast tissue, because you don't want to be in the breast because that'll make cysts and other abnormalities on mammogram potentially. We put it beneath the skin in the fatty layer. So, each of us has that layer. And as we get older, it's usually a little bit thicker. We're usually not getting thinner as we get older. So then I can augment that layer And that will help offset the changes either through the placement of the device or if they had a really thin layer to begin with.
Wow.
Wow. That's impressive.
Yes.
Because we do have a friend that's going through breast cancer right now, and she's trying to figure out what she wants to do after everything has been completed.
Yeah.
So, and you're talking about this is where they go flat, basically.
Yeah, so for breast cancer reconstruction or not, you can choose to have an aesthetic flat closure. So
Okay.
that's totally acceptable. You can have a tissue expander reconstruction that then will get converted to a permanent implant. You could have what's called a direct to implant, which is just a one stage. And then you could have your own tissue as a reconstruction, which is predominantly what I did. It's called a DIEP free flap reconstruction. And you would take the abdominal tissue, which is discarded in a tummy tuck, and you would keep that on its blood supply while sparing any injury to muscle or nerve, and then transport that tissue to the chest and then hook it up to the blood vessels underneath the sternum. And then that would be the patient's own reconstruction. So that would, provided everything went well, that would be a lifetime type reconstruction for them.
Okay.
And you can add to that with additional fat transfer if it wasn't, you know, think of like a lower BMI versus a higher BMI patient. A lower BMI patient would need potentially more fat added. So that's a way to help augment that result. So I did several thousand of those in my career, and that kind of lent itself to then transitioning more to caring for these patients where we're doing fat transfers, obviously a different, but technically very similar.
Okay. All right. And can you explain to us exactly what breast implant illness is?
Yes.
Yeah, it's a little confusing, honestly.
Oh, okay. Well, I'm glad we have an expert to explain.
I know. In an hour to go.
Yeah, so I think all of us would understand what acute inflammation is. So if each of y'all went out today after this show and stepped off the curb but happened to twist your ankle would swell up.
Yeah.
And that's acute inflammation. Your body senses that it's injured. It sends out signals and cells that secrete certain things, and it swells and you have pain. You go home and you're like, oh my gosh, I got to ice and elevate my swollen ankle.
Yes.
But after a period of time, those signals that your body's sending out go away or go down, and then you're healed. So it's turned off, so to speak.
Okay.
But when you have chronic inflammation, the signals stay on. And then each of your systems in your body can be affected. It could be your neurologic system. You could get light sensitivity and sound sensitivity. You can get headache. You can have dry eyes or difficulty swallowing. You may have skin issues with rashes that don't make any sense, or eczema. You can have shortness of breath or chest tightness. You can have palpitations. You can have muscle and joint pains. You can have all sorts of GI problems, constipation, diarrhea, bloating, swelling, cramping. You can have things in your extremities that are very disconcerting, like vibration type symptoms or burning or just electrical shocks. So it really is kind of a laundry list of things once you get chronic inflammation. So I define breast implant illness as a chronic inflammatory process of which one component is having a breast implant.
Wow.
Wow. Because Kelly has chronic inflammation.
Yes.
Because she has 4 autoimmune diseases.
Yeah.
And some of the things on the list that you're saying, I've seen her go through.
Oh, yeah. Oh, yeah. And especially right at the end when you said the feeling thing, I call them zings.
Yeah.
So I'll be sitting there and I'll feel like almost like electrical currents going through my arm or my hands, and it's very uncomfortable. I will admit. But it's interesting to me because I can totally relate to that laundry list of symptoms because my body never shuts off. So it's always on attack because it attacks the good and the bad. Like that's just, my body hates me. But that's interesting that all of that can happen from having a breast implant.
Well, I try to look at it just like someone who doesn't have a breast implant but has all those problems. So those are all chronic inflammatory type symptoms.
Mm-hmm.
And then what are the root causes of those? So in my practice, I have a program called SHARP.
Okay.
It looks at functional genetics. So everybody has genetics they inherited from their mother and father.
Mm-hmm.
And that lends itself to how you detox. I'm sure your audience has heard those words, detox. So
Mm-hmm.
there are things in our immune system, we'll say.
We love ProCare. You guys know this. And guess what? They have a brand new product out and it tastes like an orange Tic Tac.
That's right. I have got it in my hot little hands right now. It's their easy to swallow tablet in Citrus Grove. And both of us have fully switched over to it.
We had to because it's easy to swallow, doesn't stick, and it has 45 milligrams of iron. And we both need that.
Yes, we do. So go to procarenow.com to take care of all your bariatric body needs. So use code OSLP at checkout. Are you feeling a little sluggish? Little lack of protein? Little lack of caffeine? Well, we got the fix for that.
That's right. Dive Bar Nutrition has the best protein bars. They have caffeine, protein, and they taste delicious.
So head on over to divebarnutrition.com and use code OSLP at checkout. You all might be asking yourselves, why do these girls love Just Meat so much? Well, we're going to tell you.
Yeah, because so much freaking flavor, guys.
Yes,
like,
oh
it
my
is
God.
insane. And I love to cook, and this has cut down my cooking time like in half. Literally the meat part, 2 to 3 minutes.
Who doesn't want that for cooking? And I love, love, love the fact as a single person, I can cook 1 pack and eat that for the rest of the day, the rest of the week.
Yeah.
The rest of the
insane.
week, people. And I love that it comes straight to your door. I don't have to go to the grocery store. I don't know about you, but I don't like going to the grocery store.
No.
So having this delivered is ultimate.
It is ultimate. And you just go to justmeats.co, pick out all your different flavors. You can really mix and match what you want, and then use OSLP 25 for you to get $25 off your order.
Go now.
Our vitamin D metabolism affects our immune system. How our B vitamins are metabolized affect our immune system. How we detoxify in our liver through our glutathione utilization affects our system. And then our antioxidant system, and everybody's heard of vitamin C. Vitamin C is an antioxidant.
Yes.
So these things are paramount to having a really strong functioning immune system.
Okay.
And when they're off, you'll be more susceptible. And then through your exposures through life, for whatever reason, where you live, maybe where you work, the air you breathe, the fluid you take in, the foods you eat, all add to your toxicity burden. And if you already have a difficult time with detox and you increase the burden, many functional practitioners will describe it as the bucket is now full, it's overflowing, and you become more symptomatic. So that laundry list of symptoms that maybe started small now grows and grows. It grows to become the list I rattled off for you.
Yeah. I mean, I experience most of those things on a daily basis. So it's interesting also to me that you do the genetic testing, because I had no idea this was in my genetics. No clue. My mom was adopted. Don't talk to my dad. Dad's family is not really around. So I had no idea. And then I got diagnosed, and then my sister got diagnosed with lupus. And then my mom got diagnosed with rheumatoid arthritis. And we then finally figured out, all of these things run in our family, and we had no idea. So I love the idea of doing genetic testing so that you are more aware of what's in your, what could happen.
Yeah, it's very difficult to outrun a bad diet, and you can't pick your parents.
Yeah, that is true.
I love that.
Yeah, I really like that, because you cannot.
You cannot. And then the diet thing, like, because, we're bariatric patients, we are very focused on protein, water, getting our vitamins.
Yes.
Can you talk to people about why this is so important, especially when you have a tiny tummy?
Yeah, for any cellular process to work, if you can't get nutrients into your system, either because you have malabsorption or a limited ability to absorb, none of the cellular processes that are imperative for function will work properly. So I have a lot of patients that don't or haven't had gastric bypass, but have impaired absorption. So the majority of our supplementation is all liposomal or orally liquid use. The vitamin C, our B vitamins, our glutathione, and our vitamin D3K2, they're all liquid. So I try to really limit pill fatigue or what are barriers to compliance. So I want to, at a baseline level, get my patients prepared for any type of treatment or procedure through proper nutrient supplementation on the front end. I just diet, and in general, if you're going to be a client of mine, you don't eat gluten or dairy or seed oils or fructose or sucrose or any junk food out of a bag or a box, because that's not really food.
Wow.
I like that. I like that.
What is pill fatigue?
Just taking too many supplements. I'll have people, consult or do a session with us and say they've been placed on 40 supplements or 60 supplements, or which is, I think, I have a very complicated patient population and everybody's trying to help them. They seek out different providers and everybody's got a niche or a way they want to try to help them. I think from our perspective, everybody's trying to help. And it's all very, with the best intentions. However, when you look at the genetics of the patients, their problems with absorption, you have to pick and choose your battles. So I try to focus on what I know will help their immune system, try to give them the best possible quality in terms of liposomal supplements they can absorb, and work from that standpoint, get their detox plan organized, get their surgical plan organized. I have teams running both, get the surgery portion completed for them and try to get them on the track to healing. Without gut healing, you can't really have healing.
Yeah.
Because if your gut doesn't work, nothing ultimately will work.
Well, and that's what I keep hearing is like the gut is really doing a lot of things for you.
I was actually going to say that too. Is that I keep seeing these things all about gut health and what it'll do to help you with like these, the headaches and the being so tired, and like there's all these things, and apparently gut health is like a huge thing. I had no idea.
Well, if we look at it from nutrients, I'm putting people on very, very high protein diets, and we'll just say that, absorption is adequate. We'll just take for an example. That's okay.
Okay.
So usually a person's body weight in kilograms, we'll say on average, I'm usually dealing with people between 50 and 70 kilos, which is like 110 to 150 pounds. And I want them to have about 1.5 grams to 2 grams per kilogram of body weight. So I'm usually putting people on 100 to 200 grams of protein a day.
Okay.
And that's usually met with that response where it seems, but if you're going to heal, that's what your body uses to heal. It's not fats and carbohydrates, it's protein. And usually, if we want to be very basic about it, it's amino acids. So we use forms of amino acids. We use a form of protein, ultra P protein in my line. And we try to get people to engage and eat the way I discussed. So you want to eat a gluten-free, dairy-free, seed oil-free diet so that our inflammation is lower in the process of recovery. Because when I operate, or any surgeon operates, they increase inflammation. So we're trying to be as intentional as possible about decreasing it, and then creating a suitable environment, efficient as possible for recovery.
Okay. Well, yeah, because I've learned through just when my ex had a really trauma surgery that protein is number one for healing. And a lot of people don't realize that. They want to fight it. They want to act like it doesn't do what it actually does. And then, like you said, like it literally is to the amino acids, because we know that you need 11, right? To have a complete protein. So, and like veggies and some other things can only have like 9, and like animal protein has 11. So it's like, we really need and correct me if I'm wrong with those information, but like we really do need the protein, guys. Like it helps heal everything in your body.
Yeah,
even when you're sick, like you need protein.
Yeah, I mean, even with my mom being in the hospital last couple months ago, last month, that was my number one thing is, Mom, you got to get your protein. I was like, I will send you protein shakes if you need me to, because you have to be getting your protein.
Yeah.
Because she's diabetic and she had an injury to her foot. That's nothing to play around with.
No.
At all. So I actually challenged her because she was like, I think I get enough protein. I'm like, okay, well, just out of curiosity, can you just like write down
track it a little
bit for one day? And she came back the next day. She's like, yeah, I don't have enough.
Yeah,
I'm not getting enough.
It's not really part of the Western diet if you just think about it. So that's more of a Mediterranean type concept, and they will typically eat more protein just by the nature of their diet, because it's mostly a kind of a meat, fish, not as much poultry type diet.
Right.
And we're more of the bad carb bad diet. And I have all sorts of diets that, we're faced with in our clinic, and I'm not I don't discriminate against the particular person's philosophy about their diet. I just let them know that in order to heal in an efficient way, you have to get more protein, and folks who follow a vegan diet have the most difficult time. That's why our pea protein is the choice, so that there's not any pushback from that perspective. And I get it. I don't, you can do whatever you want to do, but if you want me to take care of you, I need you to do these things.
Yeah.
Hardest
thing is to change behavior.
Yeah, for sure. So when you put them on the no gluten, no sugar, no all of that, is that just while they're getting surgery and after? Or is that something that you would prefer patients to be on forever?
I think if you want to live your best life, live as long as you can, fulfill your, whatever you want to live to in terms of age, you have to decrease inflammation. Basically, what I've just given you is the keys to the castle in terms of lowering inflammation. So if you follow a diet like that, you will lower your inflammation. It's impossible not to.
Oh, wow.
Okay. And so what I'm hearing is that inflammation is playing a huge part in our basically for us to not be sick. Is that what I'm understanding?
What's happening in your co-host body is inflammation.
Okay.
So
that's what we're decreasing is the
inflammation. Right. We're decreasing the inflammation. But if we have high inflammation, then we're more susceptible to being sick, correct?
Yeah. And that's why people pass. They get too much inflammation in an organ system. Alzheimer's is the brain, heart attacks, strokes, lung disease, other factors, kidney disease, diabetes is a big problem with renal failure and needing dialysis. The kind of nerves and nervous system problems are more complex, but they all, if you look at them, if you get to root causes of most of them, it has to do with increased inflammation in that system. And if you go backwards, genetically, we can handle a certain amount. And when you get faced with more and more and more, or you have a difficult time with your diet, or you don't get enough rest, or you don't exercise, you have more of a sedentary type lifestyle, it gets to be pretty complicated for you on a day-to-day.
Yeah,
I would agree. Watching a lot of the things that you have to go through, because it affects a lot of the sleep and all the other things.
Oh yeah.
Can you talk about sleep a little bit and why it's also important for our health?
Sure. I just saw a patient who was having a really difficult time with her recovery. And people will usually tell me exactly what's wrong with them if I listen to them long enough and ask enough questions.
I'm sure.
So she told me she was waking up at 2 and 3 and 4 every day. And so that's not compatible with recovery. So the only time you recover is when you sleep. So everybody listening understands that. So if you feel as bad when you wake up as you did when you went to bed, that means a couple things didn't happen. You didn't get into theta, which is deep sleep, and you weren't there long enough.
Okay.
Usually need that needs to be between 2 and 2.5 hours, depends on the person, for deep sleep. And if the temperature doesn't drop enough, you can't really get into deep sleep. So it can't be super hot in a room.
Mhm.
And I tell patients to follow basically a 3-2-1 rule. Stop eating 3 hours before, stop drinking 2 hours before, stop screens and things like TV an hour before.
Okay.
As if you're somebody who's like on TikTok or whatever right before you go to bed, you're not really gonna get to sleep and let everything happen that needs to happen. Because when we fall asleep, that's when our growth hormone gets released. That's when we can recover. Our lymphatic system works better. And we have this washing over the brain, if you will, of our lymphatic system. And that's, one way you eliminate or take out the trash from the day before for your brain.
Mm-hmm.
I like the way that you did the 3-2-1 because
Mm-hmm.
that makes complete sense to me. I've been trying, even for myself, the screens at night. I've been trying to like slowly bring it back to
Mm-hmm.
getting like a full hour of no screens before I go to sleep.
Mm-hmm.
I'm trying to work in like reading a book before I go to bed, so I can actually like completely turn off and get a
Mm-hmm.
nice quiet rest.
Yeah.
Well, it's very hard. As you can imagine, the majority of my patients are women. There's a lot of stress. They're, usually caregivers for not just themselves, but their families.
Mm-hmm.
They work in addition, as well as take care of all the things at the home. Um, Women have obviously more estrogen than men,
Mhm.
and that's a stressor. And then when I operate, I increase their cortisol. So you can see how that can get off the rails very quickly.
Mm-hmm.
And none of my patients are very patient.
I believe that.
So
Yeah.
appearances that change, um, things that, um, psychologically are more difficult for them to handle. Uh, there's a lot going on, and stress hormones like cortisol and estrogen don't make it any easier to cope with. So part of my program, we have a clinical psychologist, Amanda Savage Brown, who helps with our patients. And then we have health coaching for support. I have patient advocates for support because although I know a great deal about surgery and helping people recover, those are things that are outside of my purview. And I recognize them and they're extremely important. So that's why we built programs and processes around them.
Can we go back to cortisol?
I was gonna do it too.
Yeah, because I keep seeing things about cortisol and the stress hormone and how it can affect your system. What is a way that we can help ourselves decrease the amount of cortisol that is in our system?
It's in my world, the way I think about it is your stress system is your fight or flight system. So when that system is activated, and I activate it because of surgery,
Mm-hmm.
I stimulate it and it has to come down. So we know it's going to be elevated after surgery. And then we try to get folks to live in a more parasympathetic state, which is conducive for healing. So,
Okay.
I'll tell you how I want them to go about it and how I explain it
Okay.
to the patient I just spoke about.
Perfect.
So there are some hacks for sleeping, which I could get to, but in the morning, you have to get up and, if you want to think of grounding, go outside, put your feet on the ground and get grounded.
Yeah.
Get a little bit of sunlight, breathe in and out of your nose and blow out through your mouth. And then you got to find yourself
Mm-hmm.
and you have to get on track that way first. And then things can follow suit. Maybe it's your breakfast routine, your supplement routine. And you get through your day and you've achieved the things you want to achieve. You've, from a diet standpoint, got the protein you wanted in. And now you're to the time where you're considering sleep and you're going to do 3-2-1.
Mm-hmm.
Maybe people are having a difficult time. So I have them take a little bit more magnesium. I have them take a little bit of our deep calming support and some of our melatonin SRT, because you have to get to theta, which is your deep sleep.
Yeah.
And once you can get there and stay there and keep yourself in a more calmer parasympathetic state, you can help get your cortisol down.
Okay.
But short of things that are a little bit outside your purview, you can't just control cortisol level easily. I mean, relaxation techniques, which is kind of what I'm talking about. I already have you on a high protein diet. I don't operate on people who smoke. And obviously we provide a very specific supplementation pathway. Those are the most important things, but stress is stress, and people have to have systems and mechanisms to cope with stress. So I do Qigong. So that's not everybody's thing. Some people want to do Tai Chi, or they go for a walk, or they read a book, or, there's some practice they have to. Nobody's probably great at giving themselves gratitude, but that's a practice we all, should engage in.
Okay.
And each of us has wins every day, although we're very easy. We're quick to identify losses rather than wins.
Yes, our brain wants to go to the negative first.
Oh, for sure.
Yeah.
I mean, I did it this morning.
You did.
Yeah.
Yeah. I was like, wait, hold on. Now I know what you're talking about.
So I saw a thing that it was high cortisol levels show up in the body with like a, like more of a pooched abdomen, a hump on your neck. And there was something else. Oh, I don't remember what the other thing was. But is that true?
Usually you're describing somebody who's been taking steroids for a long period of time. So cortisol is your intrinsic, type of steroid, but that's glucocorticoid use. So if someone was a transplant patient, they were put on steroids for chronic use steroids, they get what's called a buffalo hump. They would have kind of a moon face. So when you're been treated with steroids, or you've got too many steroids in your system, that happens.
Okay, which that tracks, because when I saw this, I was like, oh my God, that's me. Like I carry that stuff, but I forget that I was on prednisone for 5 years.
Yeah.
So because I couldn't get out of pain, and so they gave me that, and then I was also on numerous other stuff. But so that actually makes sense.
Well, and you had the moon face.
I did have the moon face. I always thought my face was round. It's not. It's oval.
Yes.
Yeah, it's a challenge. Steroids block your, white cell response, specifically. And it's not, you would rather know kind of why and how, and try to address it in a more meaningful way rather than just use steroids to block it. Because you're not really solving that problem.
Oh, you're just putting a Band-Aid on it.
Yeah, that's exactly what it is. It's a Band-Aid.
That sucks.
Yeah. I don't have to take it anymore. Thank God.
Yeah.
So, yeah. So I'm good now. But it was very interesting when I saw that, and then when you said it about steroids, I was like, I don't take steroids. And then I was like, oh, wait,
you did.
I did.
For a long time.
I forgot about that.
Yes, you did.
That was not a fun time in my life.
It would be uncommon to have that problem if you had not.
Right.
That is true. Wild. That is true.
Well, and so with our patients, like myself and Kel and this community, we've been told that like when we lose the weight, the skin is very thin. So have you come into situations like that when you have to do like the breast implants or the tummy tucks and things like that, and how you would have to maneuver?
Yeah, based on my background, I did not really get referred those types of cases because of my oncology background. Now, we're all familiar in plastic surgery with weight loss, and the ramifications of massive weight loss are significant on patients and require sometimes very extreme procedures to help correct them based on the amount of weight loss. So I think, we're now in this time where people are being placed on GLP-1 inhibitors like semaglutide and tirzepatide, Ozempic and Mounjaro, and those are changing behavior, and people are losing weight. Some people are losing weight not at the same rate as you would with a bypass, but still losing weight, large amounts of weight pretty rapidly.
Right.
So in a perfect world, you lose the weight, your skin can accommodate and adjust and tighten to the best of its ability, and then you can see, what, if anything, needs to happen.
Yeah.
Or trouble there is with the skin in terms of stretch marks or laxity, then you get into these situations where there may be hygiene issues, or you may need to, do some sort of procedure to help address the breast area, the tummy, the thighs, whatever that,
Yeah.
may entail.
Okay. Yeah. Cause I have, I'm also on a semi-glutide. So I lost about 60, I think it was 60 pounds within a year, after being on it. So it brought me back down because I had regained quite a bit. But I definitely do have the stretch marks. What about stretch marks make it difficult?
Oh, great question.
Yeah, so a stretch mark is a tear in the dermis.
Okay.
So that is not an event that you can recover from, meaning I don't have a specific modality, to correct it.
Okay.
What I have done for just small areas of stretch marks, outside of what you're speaking with large amounts of weight loss, is do different microneedling treatments, and now we have microcoring, so you can remove portions of it.
Oh.
And get it to tighten so that it's not as wide or as long, but it's an actual tear in the dermis. And that's the event that once you have that tear, think of it, it's not incongruity anymore, and it can't just tighten up on its own.
Okay.
That makes sense.
Okay. So I don't have it all together. You do. I had a thought. I couldn't get it to make sense.
I love it. I love it. So Dr. Rob, I want to go back a little bit to the breast implant illness part. How does someone know that they're what are the signs that you might have this?
Yeah, the symptom list I went ahead and ran through is the big issue. So people will go to different providers with those different types of symptoms. It may be a rheumatologist, it may be a GI doctor, it may be their GP or their OBGYN or endocrinologist, and they rattle off that list. And nobody knows what to do with that list.
Right.
It covers too many systems that are not in the purview of that specialist, and then they don't know what's going on. You may get placed on steroids or methotrexate or something else. And I think I have a pretty specific patient population that comes to me now. So they've been to all the specialists, they've been to or been through all the programs and tried all the different functional things that, they can get after.
Yeah.
Then finally, it takes a while to arrive at that point. People don't want to have that conversation, and that's fine. When someone comes to me, I don't tell them they have to have surgery. I just explain to them what I've seen over the last 7 years with over 2,000 explants and about 4,000 consults.
Wow.
And just try to give them the best kind of picture of it. Now, I do help them with testing, looking at their genetics, toxicity burden, gut health, food sensitivity testing, and hormone balance to give them a better understanding of why they're experiencing what they're experiencing. And, just like I've explained, chronic inflammation for you all, give them more in-depth understanding of that.
I really do love that you are giving them a full picture.
Yeah.
It's not just, this is what you have, and I say so because I'm the doctor. You're doing all of the testing, and you're explaining to them and giving them a full picture of what's going on in their system versus, I've been to a lot of these doctors that are just like, you just need to do this because I say so. Instead of explaining to me okay, well, your levels are here, they need to be here, or this is in your genetics, or like you said, the gut health tests, all of those tests give really great feedback to the patient to get a full picture.
Well, I guess for our, from our side, we're trying to provide you and for your audience listening the information you need to make an informed decision. Like, I don't tell people they have to have surgery. That sounds ludicrous to me. I don't make that decision.
Yeah.
I provide you the information and you make that decision. So that's what an informed decision is. So that's what I'm trying to do, is make sure I give you the information, as much data as I've been able to accumulate over time about this, so you can actually come to a conclusion that makes sense for you and your family and you feel comfortable with.
Yeah, I was gonna say, it's like you get all the pieces to the puzzle.
Oh,
and you're like, here's all the information. Do what you will. This is what I think is like the best, all the treatments that you could be doing. Here are the options, and let's do it. I think we need more people like you.
Yes.
Because I've never had like half of those tests, and I feel like it would be necessary. It would be nice to know.
It would be nice to know what's in your system. Yeah, I still have never had half those tests.
And you definitely should. It doesn't make any sense.
Yeah.
I don't know. I can't explain that. I mean, because I've had autoimmune, so I have the 4 autoimmune diseases, and I've been battling it for, I think, 10 years at this point. So in 10 years, I've never had genetic testing done. I've never had gut health testing. None of this has ever been done.
Yeah. Well, so our program, the SHARP program, can be ran by anyone. So I wrote a book about it. They'll be coming out here soon, and there'll be ways to pre-order it off of our website. So the strategy is to look at your genetics and look at your toxicity burden, gut health, hormone balance, sensitivities to food and other chemicals for that matter. And from that, supplement you with the proper nutrients to make your immune system work better, get you on the proper, diet, if you want to say that. Don't eat things out of bags and boxes.
We call it food hygiene here.
Yeah, food hygiene.
Yep.
Yeah, proper food hygiene is very important in my program. And, I look at things holistically that way, and I want everybody to really accelerate how their recovery will go. So, cutting out gluten, cutting out dairy, cutting out seed oils, really not eating fructose and sucrose, and increasing their protein content in a way that really will help them, not just through recovery, but that's a lifestyle change that will help them just feel better and be more productive.
Well, and I want to know your thoughts about MCT oil. So I've been taking it for about a couple weeks now, just a liquid form. Take a teaspoon in the morning, teaspoon before I go to bed. And I can already see like more focused. I feel more energetic. Like my hunger is way less, my appetite. So what are your thoughts on MCT oil? Is it good for us? Is it bad? What do you think?
So, I mean, I've used it. I think, I guess what I would say is I've used it. It can be, I would say, helpful in terms of improvement like you described. I think on a whole, what I look for, and it depends on how you want to do it. It does have a fair amount of calories. So, I mean, you have to consider that depending on what your approach is. Like, I am a very heavy protein person and not a lot of fats based on my genetics. So I don't metabolize fat as well. So I really concentrate on protein.
Okay.
So that's always my focus. And for my patients, I don't really have them use a bunch of MCT oil, although it's not bad. It's how many healthy fats can I get in their diet, especially if they want a fat transfer, getting their bad carbs out. So I think it's definitely good. It's just, caloric management. If it's helping you notice a difference, then by all means, just don't like end up overdoing it with it.
Yeah. Yeah. And I've noticed that like my brain is like focusing on protein now. Like I don't even think about the other stuff. Like I've had the cookies just sitting next to my bed for 3 days. And normal Melanie would be like, I'm a cookie monster. I'm gonna eat these. But my brain is like not even thinking about it. And that's like a whole new world for me. So I was like, okay, I gotta ask Dr. Rob about this because I'm noticing all these good effects from it.
Yeah.
So
yeah.
Anything that can modify, I feel like behavior is super hard for us to adapt and change. And the GLP-1s really, I feel, are doing that. I doubt if the pharma industry knew that would happen, that they would have got them through, because the number of people that are going to be helped by that behavior change are significant. When you see people eat less fast food and you see people reducing their blood sugar, which will reduce the people with diabetes going on dialysis, like all these things will have long-term ramifications. And they're all behavior related. So that was a unintended consequence. So it's not like these drugs are not bad. I think the overuse of them is not great. So some of the dosing, I think, can be a little too high for some patients, and that has to be looked at more carefully. But they're here to stay, and they do really, I've seen remarkable changes in patients.
All right.
I love that.
Good to know.
Yeah.
All right. Is there anything else you'd like to add to the episode?
Sure. I think, and I appreciate you having me on. I think people can go to and follow and learn more about breast implant illness on our channels. So at Breast Implant Illness Expert, and on our YouTube channel, Breast Implant Illness Expert, and on our URL, breastimplantillnessexpert.com.
Perfect.
Well, and we're going to have all of that linked below on our description. So that way you guys can just click and go. And then look forward to that new book that he's going to be having.
We will let you know as soon as that is out, because I am interested. I want to read it.
I know we're science kind of nerds. We like to learn all the things.
Yes. So. Well, and I'm like the problem child. I have everything wrong with me. So we like to read about it. So
and try to fix you as we go.
Try to fix me.
That's right.
But we really appreciate you being on and giving us so much information. It was a pleasure to hear all the information that you have in your brain.
That's right. So if you guys want to watch this episode with Dr. Rob, go over to YouTube right now, click on the bell and the subscribe button. You'll get to all the other episodes that are on here. When we have doctors on, there's actually a playlist just for professionals. So you can go over, click professionals, and you can just start watching and listening to all of those, because oh my God, there's so much information.
There's a lot of information in those over the last 4 years that we've been doing this. So, all right. Well, we love you guys, and we will see you next Tuesday.
Oh, what are you doing to me?
Okay, let's do it for real.
Okay.
We love you guys, and we will see you next time. Bye. I just like to throw you off.